Hey, everybody. Welcome to another episode of the Fort Wayne Local Podcast. I'm your host, Jake Maxby. Today, our special guest is Dr. Tony Giaquina. Tony is a married father of two. He's the past president of the Indiana Chamber of American Academy of Pediatrics, which is an organization that is over 900 Indiana pediatric specialists. And they're dedicated to serving the needs of all children, and they strive to put kids first. He's a general pediatrician currently practicing in Fort Wayne, Indiana, and he specializes in the underserved patient market, or the segment. He went to Wabash for his bachelor's and IU Medical. We'll try not to hold that against you. I'm sure you're a good guy. And then he did his residency there at Vanderbilt, in the Vanderbilt Children's Hospital of Nashville. Tony, thanks for joining us today.
Oh man, Jake, it's so glad to be here. Thanks for inviting me.
For sure. So, and I couldn't help myself on the IU thing. So basically the reason I wanted to talk to you, kind of like we talked off air, is I just, there's so much noise out there. And, if you're looking at social media, it's like, you hear that everything's going to hell, and then you hear everything is, overblown. And so I kind of just wanted to get it straight from an expert and kind of just lean on you. I know I look to you for your posts, like I feel you're a calm amongst the storm. So before we get to school, we know that's the hot button issue right now. We're definitely going to talk about that. But first, I wanted to talk about, is it safe for kids to start getting their checkups? Are they safe to go to hospitals and get their regularly, their annual checkups before school?
Yeah, it's a really great question. And you're right, like balance is really what we need right now. And trying to figure out, where to weigh things. We always have to be careful that when you're hearing all this noise, that somebody's being an advocate for children at the same time. And so that's always my job as a pediatrician, is to kind of continue to remind folks that children's needs have to be considered. We really took kids out of the pediatrician's office for a few months while we were really working hard to flatten the curve. As you recall, there were hospitals in Italy, in the Lombardy region, and certainly in New York that were being completely overwhelmed. And so it was an all-out effort to really control the spread of this disease, which is really dangerous. One of the things that we did was we completely had to shut down our pediatric offices and really rethink about how we were delivering pediatric care. So the crowded waiting room, that had to go. The routine visit just to look over one rash, we thought, man, maybe that could go. Maybe we could approach this virtually. And so we really changed the way, again, that we kind of thought about healthcare and how we are going to deliver healthcare for children. And what we realized is that, we can do a lot better job of, rooming patients in. So we can, register patients online and bring them straight back into a room without them going into a crowded waiting room. We realized that we could maybe extend our hours a little here and there. So that our visits were a little bit more spread apart. So we accomplished that. And what we really have been able to do is create a very safe environment for children to come in with healthcare that they really need to make sure that they are able to grow and thrive. And that means certainly making sure that you're caught up on your growth, on your development, on your medications, but also making sure that you're being caught up to date on your immunizations. Last thing we want to do is try to avoid one disease at the sacrifice of another disease emerging, especially a vaccine preventable disease that that we have completely either eliminated or greatly reduced in our society. So I'm talking about a lot of the bacterial meningitis strains like Haemophilus influenza, pneumococcus, and then of course our more common or diseases that are extremely contagious like measles, which we're able to completely eradicate at some point in the early 2000s, and now we see pop up here and there because, again, we're not vaccinating our children. So, again, long answer, but our practices throughout Fort Wayne, not only at Parkview, but all the private pediatrician offices are open, and we've made extraordinary changes to make sure that your visit is a safe one that is absolutely worth it for your children.
Okay, and where do you stand on, when you're prepping the room, I'm sure you're sanitizing. I've read, what do you think about people saying like too much sanitizing, you're eliminating the good bacteria, you're not building your immune system? Where do you stand on that?
Well, yeah, what you're talking about is something called the hygiene hypothesis. And it's a hypothesis that started to come up kind of in the 1990s when we started to see an increase in allergies, actually. And we were wondering, are we using too much Purell, too much alcohol? And there might be something to be said for that. We've seen some studies where children that have dogs in the home have less allergies because they're bringing in all this dander and environmental exposure into the home. And so the children their immune systems are a little bit able to adapt. And so there are some studies that show that children with dogs actually have a lower risk of seasonal allergies. However, we have to put this in appropriate context. And that appropriate context is a disease that is not showing any signs of slowing down, a disease that is incredibly dangerous, that has killed more in the last couple of months than influenza has for many the last few years. And so when we're talking about worries about hygiene, we're not talking about completely depriving the immune system of being healthy and fighting off infection. We're really just thinking about, maybe the increased risk of maybe some allergies, or possibly, you might see a few less strains of viruses during the year. All of these things are going to be just fine for the developing body. And I find no concerns with using too much Purell or sanitation at a time like this, that we're dealing with a global pandemic and a real public health crisis.
Okay, good, because I hose myself in Lysol and Purell.
I do too.
So I'm glad that I get at least keep
I do too. I have my hands are pretty raw with cleaning my hands, and and we do every time a child comes in here, we completely soak it down and bleach. And that, if you're sending your kid to a doctor, that's exactly what you want. You want your doctor's hands cleaned as many times as possible in our offices as
Okay. And what about masks? Should they be wearing masks when they come in?
100%. 100%. The current recommendation is for children aged 2 and above to wear masks. And you want to do this for multiple reasons. Our goal is really to try to distance kids, as best as possible. And we'll talk about that a little bit with the school systems reopening too. But you also want them getting used to wearing masks as well as they get older. It's a good practice to get into. There's a lot of debate on the purpose of masks. For me, the most important reason for wearing a mask is to prevent you from contaminating the environment. So your sneezes can then stay inside of you, your coughs can then stay contained. There is some people debate whether it can also prevent you from exposing your mucous membranes. I'm not sure if that's the case, because I think sometimes you actually mess with your mask a little bit more than you normally would touch your face. But there is no concerns from a health standpoint of wearing a mask. Every now and then I'll see a carbon dioxide rebreathing concern, and that just does not play out in the scientific literature.
Okay, that was going to be the next question, because in some of this I'm just going off of social media comments, but I've seen,
Sure.
They say it can like limit the amount of oxygen that the child is getting. Is there any concern with that, or?
There's not. Okay. No, I mean, your bodies are really good at absorbing the oxygen that it needs. I'd remind people that the air itself that we're breathing is 21% oxygen. Our lungs do just fine getting the air concentration, the oxygen concentration that it needs. So no concerns from this pediatrician.
Okay. All right. And then now to schools. Like I said, the topic of the hour. With it right around the corner, what are your thoughts on kids going back to school?
Well, it's a great question, and the question really is, what are you most worried about? Mm-hmm. Are you worried about schools reopening from a public health standpoint? Are you worried about schools reopening from a pediatric illness standpoint and dangers to children? Are you worried about schools reopening from a teacher, educator, staff member health standpoint? So those are the big three considerations that I think all deserve consideration and discussion. And there is it's not a black and white issue, honestly, but I think that we can put, again, appropriate context to each of those things. The first we can talk about is whether it is dangerous for your child to actually physically be present in schools. And my overwhelming answer to that is no. Coronavirus in children is a virus. It's a nuisance, but it is not a disease that I am worried is going to cause danger to children. Coronavirus represents about, children with coronavirus represents about 2% of all cases, and children are about 25% of our population. That low case percentage is probably due to a lack of testing, aggressive testing in children. But the proof is in the pudding that we are not seeing children hospitalized with disease at an alarming rate or even a significant rate. Children, the risk of hospitalization is incredibly, exceedingly low. And the risk of death from coronavirus, I believe in the United States, is less than 5. Now, of course, we're talking about death in children, which is always something that should never be taken lightly. But I'm much more worried about many other diseases and public health threats to children than coronavirus right now. Am I going to send my 2 children to school when they open up? They go with our Irwin Rockets. The answer is a resounding yes. So let's talk about the dangers to the public health. The concern is that we're going to bring children in and that coronavirus is going to spread rapidly among the public. And that is something that I understand the concern of. However, we have really, really good data that shows, okay, and this is continuing to be an increase, that children don't spread this disease as much as adults do. And the reason for that is we just don't believe that children are as susceptible to infection. We think it probably has something to do with the receptors on the respiratory epithelium that actually collect and attack this coronavirus. And we think that they are upregulated in our sicker elderly adults. And that's why that they are showing a greater preponderance of the disease as well as the dangers of that disease. And the data are showing that when schools have been reopened, we're not seeing these huge spreads and increase in the caseloads. We saw that in China when they reopened, as well as in many of the other school systems in Western Europe that are now being reopened. And I have to argue too, Jake, that like, if we are really worried about the public health considerations of opening schools, then school closing down should be our last option and not our first. In other words, have we exhausted all of our public health measures for reducing the spread of coronavirus before we consider closing schools? Have we mandated masks? Have we decided to close down our non-essential businesses like casinos and bars? The answer is no. So when you're going to tell me that we're going to sacrifice our children's education and the multiple benefits of schools as an institution, which we can get into, then we are really not upholding the considerations of children like we are other public health considerations. And to me, that's unfair for children. And we are not appropriately putting kids on the scale when we're weighing that decision. And I would encourage you that if you're worried about the public health considerations and thinking that we should close schools for that, you should call the governor's office right now and mandate that we do have more mandatory masking policy. 20 other states have accomplished this, and I think that Indiana, with our cases surging, and they are going up again, then this is something that we really need to put the pressure on our public officials to accomplish. And this can be done at the local level too, so contacting your local Department of Health and saying, you know, our local, we're seeing cases go up. I want my children to go to school. We need to get a handle on this. We need a masking policy. And then the last one is considerations for our teachers and educators. And this one deserves a lot of credence because it is something that we should worry about and should honestly be the most important topic for debate, as well as resource allocation, is making sure that our teachers, our educators, our staff in the schools are safe. And it's a little concerning that we put in all of these resources for businesses reopening and hospitals having robust staff and protections, but we're not allocating the same resources for our school systems. And I think that is unfortunate, because they are the ones that are really now on the front lines of this disease, and we need to make sure we protect them. And I will tell you that I've been working closely with the school systems in Allen County, and they are all making tremendous efforts to do just that. And I believe that those efforts are going to create a safe environment for them to be protected and for our children to be able to go to school and mitigate the spread of this disease and still be able to get the multitude of benefits of going to school, which I think are only accomplished by in-presence schooling. So that's basically my spiel. And in my short answer is that I do believe that children should be physically present in school, and I do believe that we can accomplish that, keeping in consideration both teacher and educator health as well as public health exposure.
Okay, and then, well, so what concerns do you have then? Obviously there's going to be some changes, and I don't know if you want to talk about changes you make first, or maybe some of the concerns you have and how you'd address them. But I guess what jumps out as something that you maybe are a little apprehensive on with your kids going back, or do you have no apprehension?
No, I mean, I do, and I guess my apprehensions are just that we are creating a bar for disease, or I guess symptoms that are going to be able to keep children in school in an effective manner. In other words, I do worry a little bit about children being sent home and quarantined for 14 days with minor symptoms of a virus. And the reason is that 14 days, I mean, think about that, 2 spring breaks for a child is really going to set that child back. And I worry about the equity of that situation, especially if that child doesn't have the same access to e-learning, if that child doesn't have the same access to nutrition and food, and if that same child is getting all of the other benefits of school, like a safe place, mental health, the social skills that that child needs, that we are making sure that if we are sending a child home, that they're able to get back to school as fast as possible. And that would mean access to testing as well as access to a provider. So I worry a little bit about the haves and the haves not in that situation. In terms of being able to do it safely, I equate it to how I talk about pediatric drowning, which is another very serious public health consideration. There is not one protection that should be in place when we're preventing pediatric drowning. I call it layers of protection. So we need to make sure that when we're talking about being safe in the water, that we're also talking about, do they have a life jacket on? Do they have appropriate supervision? Is there a gate or a fence around the pool? And the more layers that we put in place, the more effective we are at protecting children against drowning. The same should be said too for preventing the spread of coronavirus. And that is, if we make enough decisions that are practical and that keep in mind the developmental age of the child, that we are going to do a good enough job to prevent this spread. And I think some of those considerations are going to be needing to work on our social distancing. Is 6 feet going to be practical all the time? No, it's not. But 3 feet is going to be, I think, effective just as well as 6 feet in these situations. And then, other things like making sure we're wearing a mask, making sure we're focusing on hygiene. If we can do those kind of big bucket items, our low-hanging fruit, and then we add on some other protections here and there, we are going to be able to effectively mitigate this spread. And the teachers are going to be able to protect themselves too with aggressive hand washing, wearing a mask. So these are all considerations that I feel comfortable sending my child to school, knowing that the benefits of that child being present in school is going to outweigh the slower the risks of spread.
And so do you think, speaking of social distancing with the children, like you're recommending that they don't get near each other at all, like recess, lunchroom, all that, like they need to be distancing as much? I know they're kids. I can't get my kids to stop touching anything, but the goal is to try to keep them apart if we can. Is that what you're saying?
The goal is to do the best we can.
Okay.
Again, 6 feet is ideal, but that might not be practical in all situations. We still have to have enough room in the classrooms for the children to sit down. We're going to try to rearrange their desks to have them facing the same direction instead of facing them. The hallways are going to be positioned where they go one way only. And then we're going to try to encourage outdoor recess. So, I mean, again, it's going to be doing the best we can in these situations. And kids are malleable, man. We need to give them more credit for being able to follow directions. I was always super impressed when I went to go pick up my kids from either daycare or school about how they were able to stand in line, like really much better than I would have ever expected, or sit in one spot in a circle. They really, we have to give them credit, a little bit more credit developmentally for being able to follow a lot of these directions. And the teachers are masters at doing that. They're really wonderful at being able to get children to do things that we never would have thought possible. I mean, the best example of that is the amount of parents that have called me over the last 2 months telling me their child actually has ADHD because they're now watching them at home. And then when I asked them, well, do they have ADHD at school? They said, no, the teachers never mentioned that. It's because they don't. The teachers are really wonderful at having these children follow attention and being able to complete their tasks much better than parents when they're at home and trying to do all these other tasks like do work and be parents at the same time. So I do think that children will do just fine wearing masks at school. I think that we're gonna make a lot of accommodations to make sure that they are socially distanced as much as possible and focusing on hygiene. And that if we do all of these things, as well as also making sure that we are putting the onus on parents to make sure that we're paying a stricter attention to their symptoms and keeping them home if they do have any symptoms of viruses, then we're going to do just fine with this.
Okay, and just to clarify, you think they should wear a mask from the time they get to school till the time they go home, or is there like breaks, or how does that work? Well, obviously to eat, but.
Yeah, I mean, I don't know the particulars of that. I don't find any danger to that. I think kids adjusting their mask to take a break is going to happen. And if they wear a mask 90% of the time, then that's going to be better than 10% of the time. And again, we're making layers of protection that cumulatively will have a big benefit.
Okay, great. Cool. And then just so we know kind of the other position, especially with, a lot of your clients, like we talked about, you're serving the underserved population. What are some of the risks of them not going? Like, what are you fearful of if, some of the people who maybe don't have the home life that others of us do and we're blessed to have? Can you talk to maybe some of that stuff, like some of your concerns with that, of them not going?
Yeah, it's a big question. And, I see a lot of like, well, e-learning will be just fine. And maybe for your child, it might be. And I know that a lot of school systems are giving the options for e-learning, and parents will weigh those benefits and risks, and they might decide that their child was going to do just fine in an e-learning environment. But for many children, the school as an institution is going to really require physical presence for their overall health. I maintain that for some kids, if they are not able to be physically present in school, it will be the greatest health risk that they may ever face. And there's a lot of reasons why. Certainly from an education standpoint, missing school for the 3 months that they've already missed will already have deleterious consequences that are going to be very hard to make up. Our goal is always to get a child to read by the time they're in second or third grade. And if they were in second grade and school shut down, they missed that opportunity. Now they're in third grade, and the expectation is for them to read, to learn. They are going to be completely behind and may have years to catch up. We call summer syndrome about the 20-30% of knowledge that is lost during a summer. And that is expected to triple over the 5 months that they were off, and be again compounded if schools are closed for even greater amount of time. So that's just the education piece of that. Schools also provide nutrition to millions and millions of American children, and that is another in present benefit that children receive. A mental health aspect is another extremely important aspect to consider. Schools are also armed with lots of counselors that help children with their toxic stresses, their adverse childhood experiences that lead to toxic stress, and help them honestly cope with a lot of those. We know that a child's brain is very malleable and growing growing quite fast in these first few years of child development. A school provides a really warm, nurturing, and welcoming environment that actually does have important benefits for that child's brain. Without kind of that warm attachment, children are more triggered, and they're at higher risk for having social disorders like conduct disorder, oppositional defiant disorder, that can only be improved by being in a warm school environment where they're getting not only that warmth, but also that instruction, feedback, and guidance from their teachers.
Okay, that's a lot to think about, man. There's a lot of layers, and I hope that everyone, right now people are getting so entrenched in their side, and that was another reason I wanted to bring you on, was to just give some perspective that maybe not everybody has, the same access to the same resources. And that's kind of what I was hoping to touch on today too. Well, I don't want to keep you too long. I have one more question, if you don't mind. So there's been a lot of conflicting information on, the hospitalization rates, and hospitals are overwhelmed or they're way underwhelmed. And I've read conflicting articles back to back on my feed, like I mentioned to you. So can you speak to at least what you've seen or what as far as hospitalization rates and capacity to handle more?
Yeah, for sure. I mean, what you need to do is pay attention to the data, and the data is actually out there. You don't have to find it on your friend's social media site. You can go straight to the ISDH and Indiana State Department of Health, and they have that data there. And so I encourage people to be good at, just going straight to the source. If there is one physician that I recommend following on social media, it's Gabe Boslett, who's a pulmonologist in Indianapolis. He writes the Hoosier COVID update, and he looks at the data from a day-to-day standpoint of what direction coronavirus is going, including the death rates, the hospitalization rates. And so that information is there. Currently, no, our hospitals are not overwhelmed. They have been, the hospital systems in Fort Wayne have made extraordinary efforts to increase their level of care and their surge capacity, what we call it. And they're doing an excellent job of managing coronavirus cases when they come in, screening them, and getting them triaged effectively. And so currently there's no need to fear what we saw in New York and Lombardy regions of Italy. But at the same time, we need to pay attention to coronavirus and the rate that it is now starting to spread again. And that's unfortunate. Again, is going to, in my opinion, require that us make some changes from a public health standpoint. The easiest thing that you can do if you want schools to remain open and you want to continue to go to bars and restaurants is to wear a mask. This is something that we all need to do together to control the spread. If not doing it for yourself, certainly do it for your loved ones and for the other. And, we're a community. Fort Wayne, I think we have a lot of pride in our community. That's why you do this podcast. And I think that we're better than just thinking about ourselves. We think of Fort Wayne as a community, and we need to look out for one another. And the greatest message we can send is to wear a mask and show that we are in this together, and we're going to do our best to protect one
Definitely. And actually, my last question I ask everyone is, what's your favorite thing about Fort Wayne? And I feel like you just kind of touched on it right there. Is the community. It's just, I haven't seen it. I've traveled all around the country and I haven't seen anything like this. So, well, Dr. G, I appreciate your time today. I knew you were going to be awesome. I knew you'd give us the facts, and I really appreciate this. Thank you very much.
Thanks, Jake. It was great to talk to you. And yeah, let's keep our fingers crossed that schools reopen and that our coronaviruses stay down. But again, I think that if we all put our arrows in the same direction, you know, that we'll get through this together.
Definitely. Thank you, Tony.
All right. Thanks, friend.
See you, man.